What's up, guys? Welcome to the iWood podcast. Today, I want to start talking about something a little bit different, more peak performance. I'm not just talking about physically. I'm talking about just mentally and also being, men in today's day and age. We have so many different stressors that affect our life. One of the things that's helped me, and the reason I brought this together, was because I needed something to help me be in my best performance, not just for my family, for my shape, for like my health, but also for my performance at work. How do I stay as a top producer is with these guys? This is what we're talking about right now. So can you please introduce yourselves?
I'm Dr. Alex Alonso.
And I'm Joe Rose.
And we brought them together because, number one, your experience and my experience with Dr. Alonso has helped us come a long way in health. And we want to talk today about different topics. I know we were talking about ED, TRT, and all of that. So can you guys elaborate a little bit more on that?
Well, I think it's pretty natural after I met Doc and we talked and had blood work done and did it the professional way to find out my testosterone levels and find out they were low and get them back up to where they need to be. And it's just connected to so much. I know we're going to talk about ED, but the energy level, sex drive, and even weight loss, it's just all really connected, which I've learned from being with the Nuceria folks and Dr. Alonso to learn all those things.
Yeah, myself too. I mean, when I first went to Nuceria, I think I was like 150 and I was 38. I never thought at 38 I'll be having, low testosterone. So that's something that was a shock to most people, that you get so low, even at, I guess, such a young age. Thanks to you guys, obviously now I'm in better shape and I feel better than ever, man.
So I think the other thing that's really important is, this conversation is not easy for a lot of people to have, including buddy to buddy, because everybody wants to. I'm in my 60s and, everybody's like, oh, no, I feel like I'm 18. No, you don't. I mean, you don't. But what are you going to do about it? And that's why this works so well. And I'm so glad Doc can be with us today and talk about testosterone and low levels and how you do it and get rid of ED so that you can enjoy yourself as you get older and still have all the things you were doing when you were younger. And that's what a lot of this is about.
So that's the principle of functional medicine. It's our holistic approach. It's a full body approach to your hormone balance, your nutrition balance, your exercise balance. It's monumentally important that we address all those things. It's not just about, you get to the locker room, they're asking, hey, you got any blue pills you can give me?
Yeah.
So it's like, one of the first things with those blue pills is it's just mitigating or just masking underlying issues. And that's one of the biggest reasons why, we need to address this. We need to talk about this.
Doc, there's so many different parts of this, man. I was just thinking as I was driving over, testosterone in general. People always have questions. Oh, testosterone, you're taking testosterone. Yeah, for a long time. Talk about safety of testosterone and how you go about with the blood tests and everything else to help people.
Yeah, so just because somebody walks to the door and says, hey, I need testosterone, I have low sex drive or whatever the issues may be, doesn't guarantee that that patient's actually going to be a candidate for that. So a lot of mills out there are just like, they rubber stamp, here's your testosterone, here's your pills, and you're good to go. Yeah, no, we do a comprehensive blood work. We need to really take a deep dive into what's going on with the actual individual person. We're talking about ED, that could be one of the first signs and symptoms of something greater going on cardiovascularly with your heart, because it's a flow issue. So if we don't address it, we don't really get a comprehensive clinical history on you, we're not going to know what really the underlying issue is for your ED.
What do you say to people who ask you about testosterone in general? For people who've already made up, are you sure you should be taking testosterone?
Oh, absolutely. That's one of the biggest misconceptions, bro science, whatever you want to call it. They always like, oh, that causes cancer, right? We don't have anything in any peer-reviewed journal to substantiate any causation with any cancer, strokes, heart attacks. All those papers that first came out about alleging that it could have caused heart attack or stroke have been completely debunked. That is no longer the case.
The other part of this is, if you're doing testosterone, I know how I feel. This is not my first time around the testosterone rodeo here in South Florida. But having a medical doctor like yourself that is educated on this, probably a good way to start.
No, yeah, absolutely. I'm telling you, there's a lot of people out there that just, go to these mills and they give them this prescription and you're good to go. They're not really monitoring them They're not looking for any potential side effects because, there can be some side effects to the same symptoms of low T could be the same side effects symptoms that you can get from too much T. You can get, anger issues. You can have ED issues from too much testosterone. You're converting too much into estrogens or whatnot. That could lead to also some signs and symptoms of too much testosterone. So if you're not being monitored for any potential issues, they're not doing you justice.
The other thing you guys do that I really like, Doc, and you and Mike have talked about this a lot, is for people, because this is not an easy thing for guys to talk about as you get older, and obviously our testosterone levels go down, although guys deny it all the time, which is fine. That's very normal. But I like that for people, I'd like to meet with Doc, or I'd like to get on testosterone. But I don't really want to go to an office where people see and stuff, which is a big one. It's a private thing. I love the fact that everybody can get the work done from their home. The blood work can get done from your home. You can meet with people as well, so privately. So you don't have to really let anybody know. The little secret can stay secret.
Absolutely. You can come in, get your blood drawn, and we could do Zoom meetings, or you can go to your Quest Labs or whatever it is closest and most convenient for you, and then we could just do a Zoom call, and you never have to come into the office.
Doc, talk about levels as people get older. I mean, it's real, and nobody wants it. We all want to think we're 18 forever. Normal levels for people to get at, and when you start, you've seen a lot of patients through the years. What ages? It happen at all ages?
Well, it's well documented. After 30 years of age, we have about a 1 to 2% decline of our natural testosterone production. You combine that with poor nutrition, lack of exercise, stress, and those are all like a sink for your testosterone. So it's not uncommon for me to see guys walking in their mid to late 30s having testosterone levels in the 200s. Absolutely not. I see that a lot.
Yeah, like myself. I started when I'm 30, I'm 150.
Yeah, that's and I see a lot of guys too that they dabbled in testosterones and things like that when they were in high school, and then they didn't know how to get on it or off of it, which it's completely wrong. I mean, no high school, guy should be on any type of testosterone. Right. So they got on it and they didn't know how to really deal with it, getting off of it, and I see just their body never jumpstart back to producing their own testosterone again. So we need to take a good comprehensive history and then put people back on a program.
Just goes right back to doing it the right way to get the best results for everything. You guys talk about everything being connected. I think it's really important because sometimes, like I said, it's a little intimidating when you talk about low testosterone sexually. But all the other benefits, the energy level to want to work out, which allows you by working out more, it's a lot easier to lose weight. Get more out of your weekend, so you're not thinking more about that next nap on the couch about halfway through a sporting event, and instead you're getting more out of life in general.
Oh yeah, I really think that the consequence of balancing your hormones and having good optimal testosterone levels is going to be like better sex, better improved libido, because now you have the energy level to actually want to engage in sexual behavior, to work out, like you said, and to your overall vitality improves 100% when you're optimizing your hormones. It's not just your testosterone, thyroid hormone. There's several other things that it's not just testosterone. We really need to focus on the entire person and deficiencies that person will have.
Doc, how bad is the ED problem? I mean, a lot of people don't take care of it because it's, like I said, it's an embarrassing, and guys look at it, we're almost like we're depressed that we have, and we don't want anybody to know and don't know how to handle it.
Listen, about 50% of guys have had some sort of ED issue by age 50. There's multifactorial issues. It could be stress. It could be just performance anxiety. There's guys that one night they get too drunk and they drank too much, and then they had an issue getting an erection, and then it stays with you. And then the next time around, now you're having performance issues because you're like, man, is this going to work this time again? So there's a lot of issues. Cardiac medications, antidepressants can be a culprit for ED. There's a whole slew of underlying issues that can be the cause for a person to have ED. And until you don't take, good history as to what's going on with the person, it's not just like, hey, I've got something going on this weekend. You mind slipping me some pills? Yeah, that's not going to work. And a lot of the guys, when you first start taking it, it works perfect. And then you start to see it starts to wear off over time. It's not working the same, doc. I need more. I'm like, no, it's just like you're not in the best of health. You have diabetes, you have hypertension, you have all these underlying issues that we need to correct. It's not just, giving you the pills.
So it really is a whole bunch of things working together besides just the testosterone to help people get to where they want to get later in life, whether it's in your 40s, 50s, 60s, even 70s.
Exactly. It's monumentally important to, again, address the whole entire individual before we even, consider giving you any type of a treatment, which we have a lot of treatment options. It's not just the blue pills. There's anything from shockwave. ED is a vascular issue. We're not getting enough blood flow to the penis most of the time. So we have treatments that increase the number of vessels, coming into the penis, like through shockwave therapy. That we have a lot of success with, especially in patients that, are marginal and having diabetes or whatnot. That really helps a lot as well.
So that's pretty cool. So besides just the testosterone that we talk about so much, there is other alternatives for people that want to try different things. That's one thing Nesaria Health has.
Absolutely. We again, after we've optimized your hormones and we've changed your lifestyle to improve that, to be, like you said, like to maximize your performance in all areas of your life, professionally and socially, in the bedroom, then we can say, okay, look, you're still having these issues. How can we correct that? There's the obvious, there's the pills. There's the shockwave therapy. There's even injections. There's even penile injections that guys inject to get an erection. In 5 to 10 minutes, you're ready to go. It has a whole slew of potential side effects as well. But yes, we have several different type of treatment options.
Do you see the shape he's in?
No. I want to ask you how old are you?
Doctor, that's the one. That's what I want him to look like that.
I'm 53 years old.
Yeah, you look amazing. You look way better than I do or most of my friends. But I did want to, my experience on this was, it wasn't just TRT. You're right. I've gone in there. Mike has been my witness, and I'm like, look, man, my visceral fat is not where I want it to be. And just in the last 30 days, he saw lost 4% visceral fat, and that was making some little tweaks that you guys told me. You guys, hey, look, change this, change that. You've made a big impact in my life, at least health-wise. And I think it's important for people to go and, like you said, do your labs. Like, go get your labs, see where you're really at, figure out what's affecting this, so then you get to this and do that. Because you're right, a lot of people try to go to the TRT, they might have high diabetes or is it safe? Can they take it? I did want to ask one question of you guys. What are some other side effects besides ED that you think get you to notice that somebody has low testosterone?
Well, lack of energy, motivation, losing muscle mass, increasing abdominal girth, just like your overall disposition on life sucks. You just don't want to do anything. You'd rather be on the couch, as Joe was saying. You'd rather be on the couch watching a sporting event, just falling asleep.
So let's say you don't have an ED issue, like per se because low testosterone directly. It might be also because you're not confident in yourself, right? Like just the fact that you're, like for me, and an aspect that I had personally was that I was falling asleep in the middle of the day. I was sleepy all the time. And I think that affects your confidence. So if that affects your confidence, maybe that could possibly affect your performance, right?
Of course. That's again, it's a whole constellation of signs and symptoms that you need to address, that every individual needs to kind of take a step back and say, look, something's not right. Yeah, I could go the route of the quick fix and get some pills to alleviate my ED, and I'll get through tonight or this weekend. But in the end, you're just putting a Band-Aid on a hemorrhage, if you will. It's not going to work long term unless you change your overall life. And that's where I think we're much different than going to your PCP. These poor guys, they don't have the time to take a deep dive into your clinical history sometimes. They got 7 minutes to see you, and you're out the door. And sometimes you're embarrassed to even ask because you feel like he's rushed. Right. And you're like, hey, doc, you think, hey, so-and-so, his PA or his nurse practitioner will write a script and give it to you. And, right. So that's unfortunately, that's commonplace.
A lot of those places in South Florida too, all over.
Oh, yeah.
So I just, doing it the right way is key. 6, 7, 8 months. It's just, there's a right way to do this and there's a wrong way, for sure.
Can people be on TRT for long periods of time? How's a typical procedure, like or treatment?
Okay, so TRT is just that testosterone replacement therapy, right? And when you're going to replace your testosterone, that is not something that, it's not like a cycle like a lot of guys think, hey, I'm going to do this cycle of roids and then I'm going to get off and then I do. No, this is to replace your natural decline of your testosterone that's been occurring for a decade or more. So it's time now to bring you to the upper levels of normal. This isn't bodybuilding doses. These are not anabolic steroids. This is just natural testosterone that your body is lacking now. And once you get on the program, then you realize, wow, that's how bad I felt before. I mean, because it's such a small decline over time that you sometimes don't even feel it, that you're getting so bad and so low on your testosterone because, again, you feel terrible. You don't want to do anything. You don't want to go to the movies. You don't want to go to dinner. You just want to hang out all the time.
You're already used to feeling like not feeling well.
And I got so many guys who want to skip the whole thing and get right to the pill. So listen, first of all, you're even careful on the pill, like who to use the pill. I know, talked to you before, you want to check on that before you start doing things as well as, one step at a time, right?
Yeah, absolutely. Because I don't even know, a lot of these places, you just walk to how do they know that you're not on nitrates for your heart? And it's a contraindication to give you, some blue pills or whatnot. It's instead of just, again, asking, they don't really take a good history. Yeah, here, no problem here. And then, that night you end up having a heart attack. Yeah, so
we don't want to end it that way.
Wow.
Not a good way to end it at all. That's not going to work.
I think it is scary because I do see it's a popular thing to just take it. And like if you're on heart medication or you're something else, wasn't originally the blue pill made for to control that? So
yes, actually the first time that they started looking at that, it was for blood pressure and helping your blood pressure. Didn't work for blood pressure, but it sure gave those guys an erection. Yeah, gave them an erection. Yeah. So that's one of the things I started seeing, like the men involved in the research, they were like, hey, something's going on here that it was completely unexpected. So turned around, they used it for that.
It was a pleasant surprise. Well, guys, I mean, I can't thank you enough because you guys given us a whole another light. I think for men at different ages, don't accept the fact that these things aren't supposed to be this way. Maybe you do need some help. Maybe you do need some testosterone replacement or some other form of balancing your body. It's important for you to check out places like Duceria, Dr. Alonso, to kind of help us get to the, peak performance in every facet of life, family, sex, and even, and for me as an entrepreneur, check them out.
Right.